बिस्मिल्लाहिर्रहमानिर्रहीम। रब्बि इश्रह ली सदरी व यस्सिर ली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। The topic of today is role of ultrasound in infertility. We will be discussing about role of ultrasound in detection of in the diagnosis of different factors which are causing male infertility, and then followed by the factors which are taking part in female infertility. It's very important to have a background knowledge for the proper diagnosis of the causes. The first cause in male infertility is the scrotal swelling or pain due to orchitis or epididymorchitis. If it is of chronic origin, it can result in infertility of that male. On ultrasound, orchitis will show a testicle larger than normal in size. It will be hypoequic, but on color Doppler it is very easy to diagnose orchitis because there will be excessive flow. Then the second very important cause of infertility is undescended testes, especially when they are bilateral. A testicle lying within the inguinal canal or in abdomen will be hypoequic, smaller than normal, and we can find seminomas, the testicular tumors, if the testes are lying in the abdomen. Here is another case. We can see urinary bladder, and there is a testicle lying in the inguinal canal. It is undescended testis. Ultrasound, we can also diagnose the cases like epididymitis or epididymorchitis. The epididymal head is usually involved. It will be appearing hypoequic, enlarged, and there will be excessive flow due to inflammation. Scrotal pain due to orchitis is the most important cause, and here you can compare on both sides. There was mild degree of orchitis in left side and a high degree of orchitis, severe pain in the right side and the right testicle, and you can see the difference in flow. Due to increased inflammation, there is more flow on right side. A testicular mass in another cause, and here is a case, a sonogram showing a testicle and there is a huge mass. The mass is having a lot of flow. Then varices are also important. We measure the vessels and these are dilated. Here you can see on grayscale and on color Doppler. This is another dilated vessel. This is 6.7 mm, and usually it is taken more than normal when it is more than 1 millimeter. So this is 6.7. In some literature it is normal up to 1.5 mm, but here it is 6.7 mm, showing varicocele, dilated vessels. There are again dilated vessels in the scrotum, which are one of the cause of infertility in male. Then the second important thing is to evaluate prostate, and the best to evaluate prostate is transrectal ultrasonography, TURP. Here is a case of TURP, and we can see urinary bladder, and this is the posterior wall of urinary bladder and prostate, which is normal. Then we have inflammation, hypertrophy along with inflammation of prostate. This is BPH with prostatitis, and it is a case of BPH. In prostatitis, the prostatic part of the urethra is inflamed and there will be excessive flow on Doppler. Another cause of male infertility is Mullerian duct cyst. Here is Mullerian duct cyst, and in ultrasound guidance we can measure it. We have performed some procedures on such cases and we got 100% of results. Another important structure is a pair of seminal vesicles which appear like this on us. Transrectal sonography. Here is urinary bladder and ureteric jet. As the urine is moving, it is coming towards the probe, it will give you a red color, and if it is falling away like a fountain, the fluid coming from a fountain, then there will be mixing of color coming towards the probe and going away. So the mixing of color will show you this mixing, a greenish yellow tinge. It means the urine is coming and falling into and mixing into the fluid or urine which is already present in the urinary bladder. A case with transrectal probe, this is TURP, and a patient came after operation and having complaints of hematuria. You can see the resected prostate. This is transurethral resection of prostate, and there was excessive flow due to inflammation. Patient can come with complaint of burning micturition, and if the patient is having chronic burning micturition, it will involve the prostate and thus resulting in decrease in prostatic secretions, causing one of the main factors of infertility. This is excessive flow when there is prostatitis. Another case of prostatitis in which the patient came with hematuria. You can see the dimple-shaped prostatic part of urethra with inflammation. A patient came with hemospermia, blood in the sperms, and when we scanned with transrectal sonography, we got that there is a lot of flow, inflammation of the prostate and the prostatic part of urethra. Another thing which we can diagnose and we can have a study is erectile dysfunction. As we know, there are two Corpora cavernosa and one Corpora spongiosum in the penis. In Corpora cavernosa, we can find on ultrasound many hyperechoic areas which show calcifications along with shadowing. This is usually seen in Peyronie's disease, in which there are calcifications in Corpora cavernosa resulting in erectile dysfunction or painful erection. This is cross section of the penis at Corpora cavernosa, and we can see the calcifications. For erectile dysfunction, we inject Caverjet injection from half to 1 ml in one of the Corpora. This is the injection site. Here is Corpora cavernosa and Corpora spongiosum. Then we scan. This is the technique, and we scan the cavernosal arteries. This is the